Hello and welcome to this Coaching Veterans presentation on hemorrhoids and digestive health, presented by me, Paul Bunn, with Veterans Outreach Ministries. You can reach us at 1-888-330-1942 or visit us online at www.vetcenters.org. Today, we're going to talk about a condition that many veterans experience but few want to discuss: hemorrhoids. This is a common service-connected condition that can cause discomfort, bleeding, and embarrassment. My goal today is to help you understand how the VA evaluates hemorrhoids when they can be service-connected and how to prepare for your C&P exam with confidence. Hemorrhoids are swollen veins in the lower rectum or anus that can cause itching, pain, or bleeding. They can be internal, external, or thrombosed, meaning they contain a clot that increases swelling and pain. Although they're not life-threatening, hemorrhoids can cause significant discomfort and affect your quality of life. Example: I often have pain and swelling after sitting for long periods or straining during bowel movements. There are several common causes of hemorrhoids among veterans. Heavy lifting, chronic constipation, and prolonged sitting during long missions or deployments are leading contributors. A poor diet, dehydration, or medications that slow digestion can also make them worse. Example: my hemorrhoids started after years of taking pain medication for my back injury, which caused constipation and strain. Hemorrhoids can be directly service-connected if they developed during active duty or as a result of service conditions. They can also be secondary to another service-connected disability, such as irritable bowel syndrome, GERD, or medications used to treat other chronic issues. Example: my hemorrhoids began after my IBS flared up and I experienced long periods of constipation during my time in service. Some cases may qualify for presumptive service connection under the PACT Act. Veterans exposed to burn pits, toxic chemicals, or environmental hazards during service may develop chronic digestive problems that contribute to hemorrhoids. When those exposures lead to long-term irritation, bowel issues, or bleeding, the hemorrhoids can be presumed connected without having to prove direct cause. Example: my digestive issues and hemorrhoids began after deployment near burn pits, and my doctor confirmed that my exposure likely contributed to the problem. The VA rates hemorrhoids based on their severity, frequency, and impact on daily life. Mild cases may not qualify for compensation, but recurring or painful hemorrhoids with bleeding, swelling, or complications often do. The VA looks at how often flare-ups occur, whether bleeding causes anemia, and whether ongoing treatment or surgery has been required. Example: my claim was approved after I provided medical records showing recurring bleeding and pain that required regular treatment. Severity also plays a major role in determining your compensation level. Occasional or mild symptoms are less likely to be compensable, while frequent or severe hemorrhoids that bleed or cause significant discomfort may qualify for higher benefits. In cases where hemorrhoids cause secondary problems like anemia or fissures, those symptoms can also be included in your evaluation. Example: my hemorrhoids bleed several times a month and have led to irritation and inflammation that requires prescription cream. Hemorrhoids are often connected to other digestive conditions. Veterans with irritable bowel syndrome, GERD, or chronic constipation frequently experience hemorrhoids as a secondary symptom. Medications prescribed for pain, PTSD, or depression can also slow digestion and increase the risk of developing them. Example: my medication for PTSD caused constipation that worsened my hemorrhoids and led to recurring bleeding. Symptoms can vary widely from person to person. Some experience mild irritation, while others have chronic pain, swelling, or bleeding that interferes with work and daily activities. Over time, severe cases can lead to anemia or fissures if untreated. Example: I've had recurring bleeding that caused fatigue, and my doctor said it was due to anemia from blood loss. Veterans who've undergone surgery to remove hemorrhoids may still experience lasting pain or scarring. Surgical scars, sensitivity, or tightness may qualify for a separate rating if they interfere with sitting, movement, or comfort. Example: my surgery left scar tissue that causes irritation when sitting for long periods of time. Hemorrhoids can make even simple daily activities uncomfortable. Veterans often report pain while sitting, driving, or standing for long hours. Because the topic can be uncomfortable to discuss, many delay getting medical care, which can worsen the condition. Example: I avoided getting checked for years because I was embarrassed, but once I sought help, my doctor confirmed it was service-related. Before your C&P exam, be honest and detailed about your symptoms. Describe how often you experience pain, bleeding, or swelling. Mention any medications, creams, or surgeries you've had for treatment. Bring medical records, doctor's notes, or photos if available. Example: I told the examiner that my hemorrhoids bleed about twice a month and that I use prescription cream to manage the pain. Lay and witness statements can also support your claim. Your spouse or family members can describe how your condition affects your comfort, rest, or ability to sit for long periods. Example: my spouse wrote that I use cushions to sit comfortably and often wake up at night due to discomfort. Documentation is essential for a strong claim. Keep a simple diary or log noting when flare-ups happen, how long they last, and whether there's bleeding or swelling. Include medical visits, treatment changes, or photos if recommended by your doctor. Example: I documented every episode of bleeding or irritation so my doctor could track how often it happens. Hemorrhoids are recognized under 38 CFR Section 4.114 and can be connected directly, secondarily, or presumptively through toxin-related digestive issues under the PACT Act. Remember, this is a medical condition, not a personal flaw, and you deserve care and recognition for it. Be open, be specific, and don't downplay your symptoms. For more information, visit www.vetcenters.org or call 1-888-330-1942. You've served your country. Now it's our turn to serve you.